We're recording.
Oh, okay. Hi. This is NUR 695. This is the week 4 cohort meeting. And Jody Knorr and Pamela Beck and myself, Shelley Robinson. We're here to discuss the objectives of the week 4 cohort meeting. So I'll briefly just describe what we're going to go over, and then we'll get to it. So we're going to talk about how we're going to stay in touch, how we're going to share business cards and contact information, and then we're going to discuss our goals. And then also we've brought 2 or 3 questions that sort of relate to our disciplines, and just have a little bit of Q&A and have a good time and talk about our experience. So we decided to go by alphabetical order, very fair and balanced. So I'll let Jody start with how she's going to stay in touch.
Well, oh, go ahead. I'm sorry. I was going to say if it was alphabetical, then technically I would be the first one.
I know.
It's okay.
Okay, sorry.
No, it's okay.
Do I have it wrong?
He was going by first name. It's okay.
I'm really sorry. So it would be good to clarify, did I mean first name or last name? And so, yeah, I meant first name. Sorry, Pam.
No, you're fine.
Well, being that we're a small cohort and we have been in classes together before, we've all even been on the same team before, multiple times, I believe.
Yeah.
We all really have each other's contact information. We know emails. I don't know either of your personal emails.
Oh, okay. Share.
So that could be something that we could share, because how often are you going to check your student account? Because we're almost ready to graduate, right? So I'm excited about that. But we do have each other's phone numbers, and I really hope we do keep in touch. Shelley and I have each other on Facebook too. Pam, are you on Facebook?
I am on Facebook.
So maybe we need to kind of look you up on there.
Okay. I rarely post on there, but I am up there.
Yeah.
Yeah.
I mean, even if we don't talk much, isn't it kind of nice just to see what
everyone is up to, how they're advancing in the future in their careers? Yeah.
I think so. And then I think sometimes when big things happen to people, they will post, even if they don't post, they sometimes get tagged, and I feel like when you go through something like this with people, you really have to stay connected. And I think the networking, especially at leadership and advanced nursing practice education, you really have to network, and that's much more important than what I realized. So I always like this. Plus we were a military family at one point in time, and so staying in touch with everyone, I think, is really helpful.
I agree, and I'm pretty sure that we'll definitely see each other in the future, especially me and you, Shelley, being in the same cohort.
Yeah, it's always good. I think that's exactly how we should stay in touch, and in fact, I will share my personal email with you via our school email so that you have that. We text, and I feel like you're in my contact information. And although I don't have a business card right now because frankly I've been too busy to order them. Plus you never know how things are going to go. But if I do get business cards, I'll send you guys one.
Okay.
A real one.
Sounds good.
Yeah.
I'll just to make it easier, because I think we all have iPhones. At least, don't we all have iPhones?
Yeah,
if I'm not mistaken?
I think so.
So I'll just send my email information through text. That way it's easier to save in the contacts, because we already have the phone numbers. And that we don't have to copy and paste and all that stuff and manually type.
Yeah, that's a good idea.
I'll do it that way.
Okay. So I think we've shared all of how we're going to stay in touch. How about goals? What are your goals, Jody?
Oh, I have big goals, and actually they're all kind of coming together.
Oh, good.
So my 5-year plan is to be at the beach in 5 years. So you guys probably knew that already, but we actually we are in the process of buying some land in St. Helena, so southern South Carolina. and hoping to close the week we graduate.
Wow, congratulations. Yeah, that's big.
So my goal is really to teach online and be at the beach within 5 years. And I say 5 years because my youngest will be graduating in 5 years.
Okay. Makes sense.
So I have started applying for online positions.
Mhm.
I'm still working full-time at ECPI, the PM program, and actually today put an application for the assistant director position.
Nice.
For which program?
So although I'm educator cohort, I might be leadership shortly.
Yeah.
So we'll see. But, so I plan on staying here for now and hopefully finding something online to supplement income and get me some experience and then be at the beach.
Yeah.
Sounds good.
Well, so seeing as how we're going to share some contact information and you're going to be at the beach, I just want to know if part of your 5-year plan might include drop-ins from your cohort class.
Definitely. We'll be 5 miles from the beach.
Awesome. It's great. Great goal. Yeah.
Nice vacations. Yeah.
How about you?
Life, less work. That's my
Yeah. Yeah. Good self-care. That'll make, it's a great goal.
Mm-hmm.
How about you, Pam? What are your goals?
Oh, I have a few. One of the things that I want to do is by March of 2019, I've always talked about it, but I actually want to take the CCRN. I think that it's a way of, validating myself to show that I am an expert in my field. I've been in the ICU now for about 4 years. I've been a nurse for 6 years. I love critical care. There's nothing more that I love. And even though now, we're close to graduation in the leadership program, I even told Dr. Clark this a while back when I first started the program. I started the master's program. I wasn't really sure what I wanted to do, but I wanted to go ahead on and obtain my master's before it was a requirement, how it was for the bachelor's program. And now that, I'm almost done with it, I actually have, I would say, more of a vision of how, I can make a difference in the future as far as a nurse leader, because I see a lot of different things that I'm amazed by, and some things that, disgusted is not really a good word, but it's truthful, And I think that some levels of leadership can be revamped. And I think that when you get far away from the bedside, it makes it hard to dictate how care is, going to be carried out when you're so far away, So passing my CCRN and, of course, applying for a couple of management positions in which I've just started doing that. I wanted to wait in until I was closer to graduation because I didn't want to start a new position and have all of that added stress. And then I think somewhere down the line, my youngest, she's in the 1st grade right now. So I think that maybe by the time she's 3rd, 4th grade, I actually want to go to school and obtain an MBA, because I think that that's going to help me further in leadership. So those are my little simple things that I want to do.
That's great.
Nice.
I think that was really important what you said about getting away from the bedside, and that's a lot what we talked about in our throughout our leadership journey. It's sort of woven throughout that we really have to listen to nurses at the bedside, because they're going to have the best input as to what the best answers to some of our problems, because they're proximal to the issue, right? So it's really sort of involving them. And I think some places miss that, and pulling them in, and they either miss it or they've forgotten.
Yes.
And so I think that's really important, that we're there to remind them and to sort of bring it back.
Yes.
And then as you move through your, as you're applying, I would look for any sort of like task force groups in your organization or in that you can be part of, so that when you start applying for those leadership positions, that you have a little bit of sort of that to add to your resume. You might already, I don't know, but like any nurse practice councils, if you do any of that stuff, those are really good things to have. Those show sort of informal leadership.
Mm-hmm.
Any of those things, charge nurse, nurse practice council, a task force that you were a part of, a committee that you serve on, any of those things are good things to include in your resume when you're doing that.
Gotcha. Yeah, I'm definitely not a part of any committees. And, it's funny, especially being in this particular program,
Yeah.
I learned a lot along the ways. And I didn't realize how important, like, shared governance, your
Yeah.
mentor, all of those different, programs that they have for the nurses. I was never interested in being a part of those. And even when they do peer review, I was never interested in going to any of the meetings just to see, what was going on and what could be done differently. But now that I'm in a different headspace, I'm like, man, this is really important for your career. So now I try to encourage other junior nurses, hey, you guys should get more,
Yeah.
So.
Sort of lead by example. And then that's kind of going to be our job, is to sort of instill the why for them.
Yes.
Because wherever you were, you didn't have that person to inspire you to sort of move into that and embrace it. And so that'll be on you to get those people involved so that someday they can take care of us.
Yes.
I think, Pam, too, some of it is just when we first start nursing, especially in critical care, we are so focused on learning all of the things that we don't know.
Right.
And so we don't have, it's kind of like moving up that whole Maslow pyramid.
Mm-hmm.
We don't have, we have to feel safe and secure in what we're doing before we can start looking at the big picture.
Mm-hmm.
And kind of what I see is around the 5 or 6 year mark is where people start getting more involved and wanting to make things better and make a change, because they can step back from their day to day and see what's happening around them once they get comfortable where they are.
That's a good observation. And I think where you're at sometimes in your family life, so a lot of people who have who are just having babies or just had babies, their passion is not there, and that's okay. Like some of the people that we have done evaluations with, and we share kind of things they can do to help their evaluation if they were looking to step it up or make part of the clinical advancement recognition program is that they serve on a task force, and some of them don't have the energy or the time. And that's really fine, because people move through their life and have different levels of energy, and you want them invested when they have that energy. And when it's time for them to focus on their family, that's okay too.
Yes.
Yeah. Good point.
I can definitely see that now. And that's just like Jody, you mentioned how, in the future, even though you're in the leadership, I can't even speak, even though you're in the educational track, that, we're going to cross paths in leadership. It's kind of how, like, for my graduate project, I kind of almost crossed the bounds of education, but I felt with the way that everything was going, I actually did mine based upon professional development. And I felt that professional development is not just an educator's job, it's a manager's job because as well. And it's also the nurse's responsibility, because you should want to learn more. And I feel that sometimes when we graduate nursing school, we feel like, hey, we learned what we needed to learn. We passed the NCLEX. We're going to get orientation once we go out to the unit, and education stops there, but it doesn't. So it was a very interesting project.
Yeah.
Sounds like it.
And I sounded like a true spoken educator.
But that's one of the things I try to make sure my students know is that, as a nurse, we're constantly learning. So don't, and that whole, when you graduate, you feel like you know everything and you really know nothing. Like, do you guys remember that feeling?
Yeah.
So I have the students that I'm teaching right now are done with school, and when we're done, so 10 days.
Wow.
And they're all kind of flipping out because they don't know what to expect. And, so I've been trying to make sure that they understand that when they're done, they're not done. They'll never be done as long as they work in this field.
Yeah.
And then don't be afraid, because I remember when I became a nurse and I was working telemetry, I had coworkers around me that I was always reading something, and they were like, Pam, you're always reading a book. And then I found myself back in school working on my bachelor's. And now that I'm almost done with my master's and we fast forward, some of those nurses, they just remain stagnant where they were because they didn't want to do more than what they were doing. They became very comfortable. And, we fast forward, I moved on. I've been in critical care for the past, 4 years. And here I am at the door to get my master's. And now they're just like, oh, I want a career change. And, now I want to go to school and get my bachelor's, where it was like, how did you find the motivation to continue? And I was like, it's just me personally. It's what I wanted. I realized that how can I educate a patient or their family if I don't truly know the answers, because there are times that, there's going to be some questions that you may not be confident, or maybe you may not have the knowledge for what, the family members are asking, especially like now with me doing float pool. I go to so many different units. OB is one that I would never see, because that's a specialty in its own.
Right.
But even sometimes I get floated out and I go through to ortho. And when I float out to ortho, I'm clueless. I understand, how the system works, but that's not my specialty. Please don't ask me anything about bones. I have pain medicine for you every 4 hours. I can do your assessment, your breathing. It's fine with me. But all
You're good with circulation.
yes,
ABC.
neuro checks, But the rest of it, I'm like, I am so sorry. I apologize, but I don't know the answer to your question. And I'm not afraid to tell someone that I don't know the answer to your question. Let me get someone who works here who can better answer that question for you. And then I explain why I don't know the answer to that question. So,
well, I'm excited for you to take your CCRN. That's, I think you'll do just fine.
I'm nervous.
Yeah.
But
I took my certification during this course, my OB certification, and I was pretty nervous, but it went okay.
Okay, congratulations.
Yeah.
Good job. Shelley, tell us your goals.
Oh, okay.
Yes.
So I didn't necessarily know what I wanted to do. I mean, I knew, I got into this program because when I took the assistant nurse manager position, it was like that classic expert to novice transition that I made from OB to this, and I found out I had no tools in my toolbox to do this job that I had, and it's very similar to that feeling that you get as a new nurse, and you know that after 2 years, you start to feel a little bit more comfortable. That's kind of where I'm at now. I'm starting to feel a little bit like I'm not going to break anything. And, so it's starting to get a little bit better. But so I've sort of narrowed my goal to be, I think I'm going to continue on with education for a doctorate degree. And so I'm really looking at applying for a PhD program.
Nice.
And, I think I want to study culture, but more specifically culture recovery in post-strike health organizations.
Okay.
And so, because, having gone through the journey that I went through on strike, it was a really eye-opening experience for me. Part of my practicum, I was with one of the directors, and he was like the lead union, or the lead, one of the lead negotiators for the administration. So I was able to not actually go to the bargaining table, but I got to be in the room for the steering group when they had some of their final bargaining sessions, which was really, really interesting. And I don't think I could have probably had any better, I don't think I could have asked for a better experience as far as like the way things sort of lined up. I really hope that means I'm not being prepared in the future for something like that. But that's what it just worked out. And so I really, having also relationships with the people on the unit who also went out on strike, and how that, what I felt and what they felt. And I think, just listening to our people, and we have opportunity to sort of look and say, what's our ownership in this? Mm-hmm. And so we have ratified a contract now.
Gotcha. Okay.
So that in 3 years, we'll go back to the bargaining table. And consistently throughout this process, we'll have NDNQI data. So there I'll have some measurement of sort of like we have a before we actually went out on strike, and then throughout. And so it will kind of align, with what I'm kind of looking at. And so basically I just want how do we heal our culture after we have a insult like that? How do we, not just leaders, but nurses, because one of the things was I felt like there was so much rhetoric that I thought, how can nurses be like this? Like I'm a nurse, and how can we treat each other like this? And so I think a lot of it, one of the, our HR and talent strategies people talked a lot about anger. And she said, anger is a secondary emotion. It comes from sadness and fear. And
Mhm.
so that's drove that. And so how do we break that down, and what does that look like, at a proximal level? So it's sort of deep. I got to tell you, I watched, I didn't come to that initially, and because I really didn't know what I wanted to do,
Mhm.
Beyond this, and I sort of banged it around and I wasn't really sure. And this is very basic, but I watched the Fred Rogers documentary. If you get a chance, you should watch it. But the way he talks about communication and children, and how feelings are mentionable and manageable, I think is true in adults. And so then I was like, light bulb. So who watches Mr. Rogers and gets that? I don't know, but it's sort of deep and maybe a little bit sort of pipe dreamish, but I like to know, and I like to be better. And I think the only way to do that is to sort of learn about us and who we're with. And anyway, there you go. I'll let you know how it's going.
That's so cool.
I'll be definitely interested in hearing.
Yeah.
I'm
So
sad about school. I mean, let's put it this way. If I work someplace that wants to pay for my PhD, I will get it.
yeah.
Or, honestly, nurse practitioner, that was my original goal. Did you guys know
Yeah.
that?
It was?
I
No,
don't think we talked about that. No.
The reason I went back and got my bachelor's degree to begin with was because I wanted a nurse practitioner. And then I was in that PACU job that I loved
Mhm.
with all my employees that I loved. And I was doing full-time charge. And I had a really bad day. And I how you have that really bad day and you send out all those applications. Have you ever done that?
Oh
Mhm.
yeah.
I've done that many times. So ECPI was I saw the job on Indeed, and I was like, they'll never hire me with a bachelor's degree. And I put my application in, and I've been there for a year and a half, and now I'm doing education. So I still have this kind of in the back of my mind, nurse practitioner, but I really enjoy teaching.
Mm-hmm.
And well, I need a break for a little while first.
Yeah.
But I just don't know that I think that I would love being a nurse practitioner.
Mm-hmm.
I don't know that I want to go back to call and weekends and holidays. I'm a little bit spoiled with not having to do that.
Yeah.
So, I mean, I don't know, but it has crossed my mind. I just, I don't want to pay for it.
Gotcha.
Yeah.
So I guess the question is, if you did go back to school to be an NP, what specialty would you choose?
I'm a little bit torn. I don't know if I would want to do I mean, honestly, my heart is the ED. That's where I started nursing. So I don't know if I'd want to do acute care. I really love old people.
Mm-hmm.
So it would be between acute care and gerontology.
Gotcha.
Probably.
Okay.
Old people just are, I don't know, interesting.
Mm-hmm.
Well, that line, the two things that you said together, pediatrics and old people turns into babies, and
Yeah.
or that's what my mom always said, as they get older, they turn back into
I
kids.
love
Yeah.
Yeah.
It's true. And I always liked, I never minded. You know how you have the nurses that hate taking care of little kids?
Mm-hmm.
For me in the ED, it never bothered me, because if the little baby 3-year-old is crying because they're scared, I get that.
Mm-hmm.
But when the biker guy full of tattoos is crying because I'm going to start an IV, I don't have as much sympathy for him, so it was always easier for me to take care of the kids.
Yeah, I think I have a soft spot. I have 3 children, and it's kind of hard to take care of kids for me. I think I would be an emotional wreck. So that's the reason why I never wanted to do ED, because I never wanted to have to take care of kids.
Yeah. I love the ED. That's where I started too, and I feel like I really enjoyed it, and I sometimes really miss it and think, oh, I would love to go back there. I didn't work in pediatrics because I felt like I also have 3 children, and I felt like if I give all day, if I give her all day this way to kids, then I'm going to come home and not have anything left for my kids. Mm-hmm. That's kind of how I looked at it. And there's a whole lot more interesting family dynamic. I mean, there is in any situation, but when you're really taking care of somebody's kids, it's like, I feel like a whole more complex level.
Yes.
You know what I mean? So, as parents, you probably know, like, that's, just, so anyway, so I went to labor and delivery so I can, when they come out, then I'm like, ta-da, they're born. You can have on your breast. Okay. But go to maternity. Now you're done. But that's interesting that you say, when you talk about, like those different life cycles, and because, we have doulas for labor and delivery. And what I think is a super interesting concept is end of life doulas. I think that's a really special job. Like hospice is a special job. And I just think that's kind of an amazing thing that people do. So
yeah, that's a super special type of emotion for hospice.
Yeah.
I could not do it.
I couldn't do it.
Yeah, I couldn't either.
I don't know. I think about it. I don't know. Maybe I'll do a stint
There are a lot of jobs available for nurses for hospice.
I could not.
Yeah.
I'll go back to the ED tomorrow. Hospice.
I'm with you. If I had a choice, they'll say, "Hey, Pam, go hospice or go to the ED. ED, please."
Yeah.
Yeah. I mean,
I couldn't do hospice. I couldn't do that.
Mm-hmm.
No, but I can totally work with old people.
Yeah. It's interesting. It takes some interesting, lots of strength.
Yes.
I mean, not that you guys don't have it, but I'm just saying, like, it's just, it would be, I don't know, would be a journey. That's for sure.
I mean, I have a hard time. I struggle because, I've been cardiac ICU for a while now. And in my 4 years of being in the ICU, I've only lost 2 patients 1 year for Christmas. And, they had their issues, but the family made them DNR. So it wasn't because of like negligent of care or anything like that. But for me, it was hard because I never lost a patient during the holiday. And especially for it to be around Christmas time. And I know how I am just a everyday, I don't like codes, but I know that, sometimes that they are going to happen. And, when you have these patients and you've already been with them for a couple of days and you establish some type of, rapport with them, and then something happens and it just eats me up.
Mm-hmm.
Yeah.
But that's why I went into the ED to begin with. Both of my parents died when I was young, 19, 20, of cancer. Mm-hmm. And so my thing in healthcare is I've always been the caretaker, but I don't want to get attached to people.
Mm-hmm.
So I've done ED, I've done interventional radiology, PACU, critical care places, fast-paced places, tongue-tied, but never any place where I'm going to see the same patient over and over and over.
Yeah, I understand. Okay.
Yeah.
I don't want to get attached.
It happens, especially in the ICU.
Yeah.
Yeah.
Well, we all talked about our goals, right? We got our goals.
Yeah, we got goals.
Okay. So then we have to move on to our questions that we prepared to ask each other. And we'll start with Jody. Okay.
So you guys are both I was struggling with how to ask questions because they were supposed to be kind of related to my program, but you guys are both leadership. Okay. So I guess one of the things that I was wondering is, do you think that there's a possibility that either of you will ever teach, whether that's as an educator or a preceptor or in a classroom?
Well, I'll start, Shelley. I think for me, there's a high possibility that I would teach. I think that, as I mentioned earlier, that between leadership and education, there's that fine line. And I've just recently, I've have jobs in my box for nursing educator's position, case management. I act as charge right now. I'm also a preceptor. So it's not hard to kind of cross those lines because they really do.
Mhm.
They encompass each other, to be honest. They really do. So it's not hard to go from leadership to education or education into a leadership role, because even in education, you have to have some type of leadership.
Yeah.
So they cross paths, very parallel.
I would agree with that. And then I think about kind of what our, as we become advanced practice nurses, part of our job or part of our charge, so to speak, is to be mindful of succession planning. So what does that look like, and who do I, who amongst our that we're supervising or we're teaching, who is up and coming, or who really shows that initiative or intent to really kind of step into the role of leaders. And so I think we kind of have to look at that. And then I also think, like, as leaders, we are going to coach people. We're teaching all the time. So there's always going to be some coaching that we can do. And that's sort of still teaching, in my opinion. I don't know how you guys feel about it, but it's teaching, and it's teaching people how to talk to each other and how to be open and curious.
Mm-hmm.
And we have to almost ask. We can't tell people, when this, Jody, probably, that when people go through when they're learning about things, you can't necessarily just tell them the answer, but you have to have them be curious about what it is and ask the right questions so they can really develop that critical thinking aspect to sort of get to the answer. But it's really not going to make the right sense unless you ask the right questions. So it's almost the same way in sort of coaching people. Can't just tell them what it is, but it's more like asking those questions where they can be reflective. So I think, yes, potentially, especially if this PhD gig goes down. Maybe. So, yeah. I never saw myself as an educator, but I think that there's really important things to pass along to people, and the things that we're really passionate about, and I don't mind talking about them.
Yes.
So, yeah. What else?
Well, our Zoom's going to end in 4 minutes.
Okay.
So I'm going to stop recording. Don't